Hi, I am Dr. Kalaikovan. I am a sleep medicine consultant and pulmonologist practicing at Kovan Chest and Sleep Care Center, Pondicherry and Kadalur. We have a lot of challenges in sleep medicine practices. First, there is no dedicated sleep medicine doctor across India. The reason for that is in Western counterpart, there is a special curriculum for the sleep medicine. But in India, the sleep medicine is not inculcated even in the MBBS curriculum. We have 1.5 lakh doctors, modern medicine doctors, BDS doctors, but none of them are aware of the sleep medicine in their basic MBBS curriculum. So, naturally, when there is no dedicated sleep medicine doctors, the awareness is also very less. And we don't have a sleep lab across, even in metro cities also, it is very challenging for a patient with the symptoms to find a sleep lab. So, I think so there are a lot of challenges in finding the sleep labs, and more importantly, the patient awareness is very less, very thin. The awareness is very thin. They don't know that the sleep problem is a problem at all, unless it was said by some doctors or health aware or their relatives who have some health awareness. And one more thing, coming to the treatment of the sleep therapy, we also find a challenge, that is the cost is not covered by any of the insurance companies, be it government or private. By this date, you are aware that more than 3 crore people in India are affected with this COVID situations, and the prevalence of the sleep apnea patient getting the COVID is much more than the patient without the sleep apnea. We treat these sleep apnea patients with an NIV devices, be it with CPAP or BiPAP, from the day of their admissions. And after using these devices, we find that the hospitalization stay is reduced than the patients who are not getting these devices. So, I think that this COVID has been a blessing in disguise to make the doctors, especially the doctors, aware of this sleep apnea. So, as the Indian population, 85% they live in rural side. Naturally, the sleep patients are also more in the rural side. On the contrary, we think that sleep apnea and sleep disorders are only for the metro people, and we are targeting and we are making awareness only to the metro groups. But it is very unfortunate that the larger sector of the sleep apnea people are unaddressed these days. So, I wanted to make it a point that 80% of the sleep apnea patients are living in rural side, and this is, I am sharing it from my own experience. I have been practicing in metros, tier 2 cities and tier 3 towns also. So, over 7 years of sleep medicine practice, I find more patients are from the rural side. And more importantly, I find it the treatment of sleep apnea is boosting up the rural economy. As our father of nation has once said, the rural economy will be the backbone of our country. So, I see different sectors of people, from flower vendors, from a small textile shop, from a lot of people from the common crowd. They have been suffering from the sleep apnea over years and years without any awareness. Fortunately, I had an opportunity to address those issues, and now I feel that personally and professionally, I feel that we have to take care of the rural population very seriously, and we have to treat them because our entire economy depends on them. I would like to share my own experience as a sleep medicine consultant. I have been practicing over 7 years. The first 2-3 years I found it very difficult in bringing the awareness to the people, because there is no awareness to the general practitioners and the physicians also. Even cardiologists and other super specialists are least bothered in treating the sleep apnea patients. So, what I did is, I went and then I approached the specialists, the general practitioners, the physicians practicing in the rural India, and I made them aware the importance of referring the patients with the symptoms of sleep apnea to a sleep lab. We have established a sleep lab in our own town, and over time physician they themselves they got aware of the disease and then they started referring the patients. We have made health awareness pamphlets, articles, and one thing which I find it very catchy is that we made a poster and then we stick it to all the practicing doctors. That one campaign is that we highlighted that sleep apnea is the new diabetes. So, sleep apnea can be treated with a similar way as diabetes, since both of these will be affecting every part of your body. The patient doesn't know that he have diabetes unless he tests the blood sugar level. Only with the symptoms he cannot be branded as diabetic. He has to undergo a basic blood test, say fasting sugar or HbA1c, to tag him as a diabetic patient. Similarly, with only symptoms, we cannot treat the sleep apnea. You have to get a sleep study done. Either it could be a type 3 or type 2 or even type 1, which is available only in the metro cities. So, my strong suggestion is please do not hesitate to undergo a sleep test, and my request to the doctors is please do not neglect the patient's symptoms of sleep apnea and kindly refer them at correct time for a sleep study. Having said the importance of sleep study, I wanted to make a kind request to the hospital administrators. Kindly do a sleep study passively. Whenever the patient comes to you for a master health checkup, kindly make them to do a sleep study as a part of the master health checkup, especially for all diabetic patients and cardiac patients, because a master health checkup without a sleep test is incomplete. Thank you.